shave it.
You don't have time for shaving when somebody doesn't have an airway, do you? What do you do when somebody's got big old Fu Manchu mustache, or they got a big old Vaseline is one thing you can do, or KY jelly, and
Something stick it together.
okay, something to make it stick to the hair actually in that area. That works pretty well.
Try a smaller mask maybe, so it's not
Smaller mask, a little less,
just around.
just enough to make it. Okay. Anybody else? When you've got a big old bushy beard. You know those blob masks? I used to think those were the cat's meow, and you can't even find one anymore.
We're using what they call a Sure Seal mask.
Okay.
Yellow, it's almost a foam kind of mask, and they really seal good, even facial
Even with hair stuff? What's it called?
Sure Seal.
Sure Seal. Has anybody else used one of those?
I've seen them, but I've
You mean like is that mark like what's on the old OSC tab? That kind of mask?
Yeah, kind of a foamy.
yeah.
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 Okay, obesity, like nobody's obese.
What's the problem with that?
They have the no necks. It's hard to get their neck back. It's hard to get them in a good position.
Patient positioning is always number one anytime you're going to maintain somebody's airway. So how do you patient position somebody who weighs 400 pounds and you need to ventilate them?
Before or after?
Actually shows on another slide.
You're gonna start ventilating them, right?
You have to get their shoulders
You got to get
up.
the ear canal lined up with the top of the shoulder. Okay, good.
Age over 55. Really.
I'm there.
Yeah.
Look what it says about that. Better start pumping a little iron.
So a fat guy over the age of 55.
With a beard.
That's why they call it.
And no teeth.
Wouldn't it be nice to ask your patient if they snore at night or they use CPAP before you would have to do an airway? Because that would give you some ideas about what you're gonna have.
Teeth? No teeth. It's easier to leave the dentures in for big valve masks.
Is everybody pretty much leaving dentures in place no matter what, unless they're obstructing the airway?
Yeah, unless they're a problem, fall out or something.
You take them out for intubation? Why?
Just because it's just another obstacle, a potential obstacle.
If it's dangling, yeah.
Yeah.
I've traditionally just ignored them unless they fell out or a problem.
You hear anesthesia say that too, pretty much. They pretty much leave them in there during intubation as long as they're not in the
I
way.
mean, if I can't get them out, I can't get them out. If they're stuck and they're good and they're good, then I
You
just
have to have something to
Yeah.
pry
But
on.
usually they're.
You have to have a fulcrum.
Sometimes they fall a little bit right here.
Well, exactly. I'm with
Yep.
Tim. You got to have a fulcrum.
Yep.
But the thing
Kinda.
is, if you can't tell they're dentures,
Because then you don't have to worry
if
about
they
you
got
having
the
a tooth
super
at that
poly
point.
grip,
Yeah, that's right.
then you're not gonna fight those things to pull them out. If you can't really tell they're
No,
dentures,
if they're
nobody's gonna take
loose,
them
I
out.
mean,
If they're
you know,
loose,
I mean,
yeah.
I try, and if they're in there solid, then I'll leave them. But I'm not gonna intentionally. If they're loose, I'll take them out because it's just more problems. later.
Yeah, loose is no good.
Mhm.
We're expanding on your PowerPoint here for you.
We should leave that alone.
We should.
That's actually a very important thing though, isn't it?
Yeah,
Because
'cause if you
that
can't
goes
bag
along
them-
with being able to bag somebody. Yep. It's very good.
Now we're ready?
Yeah.
There's the short one.
Hi, Tom.
She wasn't talking about you.
Oh, I thought she was.
So they asked us for surgery, anatomy, some types of cervical surgeries that can make you.
Like if they've got a cut on their neck, they may have had their thyroid removed or, work on their vocal cords.
They're sitting in a halo traction.
Yeah, it's gonna be a problem.
That's gonna be a challenge. Hematoma. Oh, we got the obesity thing again. Our radiation distortion and radiation therapy may distort tissue.